it should be, to me, it should be into our collective bargaining agreements like anything else. It's because like I said, if I know if I'm feeling this way about having to, and I never felt this way in my entire career, do I really want to step down? I'm always like, I can do both. I can bargain and I can feed my family. And but this has been really challenging, and I've really had to say, um, am I not equipped to do this, and should I then step down because I can't be successful if my children aren't successful? And so what's more of a priority? Is it working, or is it making sure that they have the needs, their needs met? And so if we can take that pressure off of many more who are in my situation, imagine the leadership that they can continue.
So the transition to virtual school changed my childcare needs. Well, I've been lucky enough to work here from home, and the changes, it's hard to try to do my work and also be on top of my kids, but I'm lucky enough to have my mother living with me. So she watches my kids while they're doing virtual learning. The only issue that I have, though, is she's only Spanish speaking. And if they need homework help or anything, I have to step out of work and help them and their school needs. And then I also have my 18th month old who needs the most care and the most attention. So my mom's always on top of him and chasing him around the house. For staff, I think it would, it's hard on the staff. I mean, they could get sick. They probably have children of their own that they have to take care of. And if their children get sick, they can't come in. And if they childcare facilities don't have enough employees, it's kind of hard to juggle the staff that's on hand.
As a family home childcare provider in King County, we are facing huge problem due to the COVID-19. We are risking our life and the life of our family and children during this challenging time to help the families that are working during this time. We are essential workers caring for children of essential workers. We all know the value of education, but there are risks to consider, such as multi-generation families living together, expanded COVID variants, more children being impacted by the multi-system inflammatory syndrome in children. The biggest risk seems to be that we are increased exposure, not just for the children in the school, but also the staff, the teachers, bus drivers, support staffs, office staffs, nutritional staffs, because they all have families like us that could be impacted. It's tough to put kids back to school during this time because COVID will spread high, and that will cause to increase the number of people that are going to be infected, like families, teachers, children, and also a lot of childcare providers like me that are working with school children that will now have an increased risk of exposure. So that's my idea.
For us, when we're looking at how we support our brothers and sisters and siblings who do childcare work, it is essentially making sure that they are protected with their worker protections, and are compensated to be able to have adequate PPE at work, that sanitization with kiddos, the necessary instruments to do testing before kiddos come in. Um, and I know that's really challenging, especially for a lot of smaller businesses who are doing this work out of their homes, who don't necessarily have a major facility, right? Like the Kinder Cares. And some of them are union workers. So it has been work that we've done during this pandemic to represent them, to make sure that not only are they helping us as essential workers with our kiddos, but that they're safe while they're doing this. I think that's a huge priority of ours. So for me, when I'm talking about this, my job is to get buy-in from everybody to support. That has been challenging, and I think that's something we need to look at in how we frame it, because those who don't particularly have children or see this as a need, it's like, well, that's your problem, not mine. You want to be a breeder, not me. So that's something that you need to focus on, but it's not. It's all of our issues, because it takes a village. And so this is no different than any other policy that our retirement system that we pay into to make sure that our elderly and our retirees have economic dignity. That's all of us, right? When we're paying into our medical plans, I might not be, high risk or have pre-existing medical conditions, but there are those who do, and I still pay my fair share into that plan. So that way they have adequate health care and are taken care of. Childcare should be deemed as essential, just like those necessities are, to be able to thrive and live and work in our economy.